Head Start was created to help fight the war against poverty. And an important part of Head Start has always been providing comprehensive services, including health, to staff and families. What we do through the Healthcare Institute is really provide information to the families that they understand and they can use, and also provide tools that are strategic to the agencies in such a way that they can engage their staff, engage their families, to come to trainings, to learn and to use the information to be better advocates, to feel empowered in the health of their children.
We really want the parents to be the advocates for their own children, their family, their community, and that's what the Healthcare Institute does. You know, yes, it's a health literacy, but it also empowers parents to have a voice.
It truly is the work that matters, because changing lives one family at a time through what they have to understand, which is the health of their children, is vitally important to everyone.
What's great about our trainings is we really empower the families. We make them realize how important they are to their children's health and what a large part they play in their child's health future.
The piece that HCI brings to the whole conversation is around how we can integrate health into everything we do. It's not just, well, I have to make sure I get this form completed or the child needs to see this doctor, but it's how we're dealing with it in the curriculum. How are we dealing with it with family service? So how do we really build that culture of integrated health into our program that supports wellness and also looks at the outcomes to make sure that what we're looking at is that children are not only ready for school, but they're healthy and ready for school.
Building those relationships with the parents and also knowing that we're going to be a part of keeping those kids safe and healthy. Blending that piece, incorporating the performance standards with our health practices would be very helpful.
The topics that we cover are so broad and so needed and so relevant to our community that it brings all our families together. They love coming together and seeing each other and just talking about, oh, I'm having this issue, I'm having that issue, and realizing they're not alone in trying to raise healthy children. Once we have families attend one training, it is very easy to get them to attend other trainings. So if we do the basic health, very easy to get them to come to mental health, oral health, healthy eating.
This is not just what to do when your child gets sick and we can figure out whether they go to the doctor or not, but it's really building on that continuum and allowing us to really think about how we can support family health and wellness at all levels.
The Healthcare Institute did a very good job in designing programs that are very accessible to patients, that they can take home with them, share with other families, so you can have a ripple effect of improving the health literacy in an entire community or neighborhood or a family very easily.
I talk a lot about data, and that is what continues the funding for all of our approaches. But if we don't have the heart of the family at the core of what we do, the data is meaningless. We have to have relationships with our families, with the communities that we serve, and with people throughout the community that can support the families when they're out of Head Start. We have to create a culture of loving support that then has the parents knowing that their children matter. And the way that we can do that is through the health of their kids. And I love being a part of it.
The Head Start programs bring hope to families in the most underserved population in the United States. And it is wonderful to be able to even add a drop of hope by providing these families tools that they can use to improve the health of their children and their families.